Hi everybody, welcome to my channel. If you're new here, welcome in. If you're returning, I'm so glad to have you back. Let's talk about, has a doctor ever yelled at you or talked down to you? Let's talk about it. And if you like what you see here, then I ask that you like and subscribe and follow for more. So, has a doctor ever yelled at you as a nurse? Because I can think of a few times when I was terrified to call certain doctors in the beginning of my career, and even now there's some doctors that you're just frightened of. And what makes a doctor intimidating? I remember when I was a brand new nurse, the idea of calling a doctor seemed so intimidating to me because in my mind they were the supreme power, the ultimate beings. Now I've been in nursing for 25 years now, and I don't see it the same way. I feel like they're definitely more educated than me for sure, but I feel like if there's not respect, we're co-workers. Yes, you have more education and you're the person in charge of this patient ultimately, but there's a way to talk to nurses. And disrespecting and yelling at them doesn't accomplish anything. It's counterproductive to taking good care of patients. When I was a baby nurse, we had a medical director who was an older doctor, and I wasn't necessarily scared to call him because he was mostly like, yeah, whatever, which is also on the other spectrum of things not great because we shouldn't be making those decisions as nurses. Yes, we begin to understand what a doctor would be likely to order based on this symptom, and this condition. But the reality is, as nurses, we cannot make those judgment calls. We do have to let a doctor give us orders. So doctors should not be angry when we call them for those orders because they are in charge of giving those orders. That's what they went to school for. That's what they should be doing respectfully. And we shouldn't fear calling doctors because we have to collaborate to take good care of a patient. When I was brand new, I called this doctor. I reported a very high blood pressure. He laughed and hung up the phone. I didn't know what to do. I didn't know what to do. What can you do? You chart no new orders? Some blood pressures, when they're too high, can raise concerns for a stroke. Some doctors in long-term care have more wiggle room with what they will and will not do for a geriatrics patient, especially if they have a DNR. And that's not the way it should be. But that's the way it used to be when I started in healthcare with some doctors. Then you have your doctors who you cannot even suggest anything that you know they might suggest because they will be yelling at you if you do. We had a doctor, you could not suggest an antiemetic, you couldn't suggest something for anxiety, you couldn't suggest something that he had prescribed before. You needed to wait for him to prescribe it, and he had his very own sliding scale. I will never use his name. But we also had another doctor that intimidated me, but he had a dry sense of humor, and I was such a young nurse that I couldn't quite grasp his sense of humor and not have a deep level of fear for him. I had 2 patients fall within 30 minutes of each other and have to go out to the hospital for CT scan. In long-term care, when somebody falls or gets hurt or they have a critical need, they get sent out to the hospital generally, especially in a long-term care nursing facility that doesn't have skilled abilities. In a skilled nursing facility, you might take care of some critical needs. You might start an IV, you might get labs, you might, start an IV antibiotic, you might be doing some things before you seek critical care in a skilled nursing facility because you're supposed to be able to handle skilled needs in a skilled nursing facility. Now, if a person becomes acutely ill and they need medical attention, they're going to the ER from a long-term care or skilled nursing facility. That's just the way it is. The goal, though, is to prevent rehospitalization. So in a skilled nursing facility, they're going to get you to do all the things you can. I digress, as usual. And this patient fell, hit their head, had to go to the hospital, and within 30 minutes, another one of this particular doctor's patients fell, also in a strange position. Ambulating without assistance, as people often do in the evenings when they have dementia. When they have a memory loss impairment, they often get up and ambulate right after dinner when the CNAs are putting other residents to bed or in the middle of a report, because that is when their lights are going off for the longest amount of time. At shift change is when the lights will start going off and people will do things for themselves because they don't want to wait for you to do it because it needs to be done now. In their mind, it needs to be done now. So I had 2 patients fall, one right after the other, early into my shift, and the doctor said, "What are you doing, tripping them?" And I just wanted to crawl into a hole, and I probably cried a little because I was only 22, 23. And I said, "No, I'm not tripping them." He said, "Well, can you keep my patients off the floor? How about it?" I was like, "Yes, sir, I'll keep your patients off the floor." He was totally saying that with a laugh in his voice. But I couldn't read that in that moment because I was just terrified. Another doctor, the doctor that had his specific sliding scales, I had a brittle diabetic patient who would crash on me by 3 in the morning. And we only discovered this because she would start acting strange, or I don't know, when the CNAs were rounding, they would find her acting different than she normally was. This was a patient that was up at night. She would wander. She had a specific schedule. She would sleep during the day and be up at night. I don't know. And I called the doctor about a blood glucose at 3 in the morning that was in the 40s. Maybe the machine even read lower than that, but we had a standard with this particular patient. We would make sure that we fed that patient before putting that patient to bed, giving that patient snacks, high protein snacks, and a glass of milk. You know, we would do something like a cheese sandwich with a glass of milk or a peanut butter sandwich with a glass of milk. We would make sure that we gave this patient snacks, and we would even sometimes give the patient snacks if they woke up. So I had to call this doctor, and it was maybe 4 in the morning that I checked the patient's blood sugar. Normally in a long-term care facility or a skilled nursing facility, you are starting your med pass in the 5 range because your meds are due at 6. We're not typically giving insulins at 6 in the morning. Typically insulins are given before breakfast or with breakfast by the day shift. So although I was responsible to check blood glucose in some patients at the end of my shift, this particular patient was being checked at a time that it wasn't their blood glucose check time. And when I called the doctor, he said to me, "Do you own a watch?" And I said, yes, sir, I do. And he said, "Do you know what time it is?" I said, "Yes, I do, but this patient's blood sugar is this, and I need you to give me some orders." And do you know, he changed the blood sugar time check and the insulin orders the very next day. He came in and wrote his own set of orders because he did not want me to call him at 4 in the morning ever again. Still, that patient would tank sometimes. Still, we had to make sure that patient ate. Her blood sugar would be really high or really low. It was never in between. And you would be shocked that the patient would be talking with their blood sugar at that level. And when you know you have a patient who is that brittle, you're constantly looking at them. You just can't help it. I don't want somebody to have something bad happen to them. You know, it's my responsibility to look over these patients. And if I know somebody has a likelihood to have erratic blood sugars, I'm going to be having to watch them more. That's just the way it is. So that particular doctor would yell anytime you called him. And also, anytime you called him for anything, you might plan on sending the patient to the emergency room, even if it was something as minor as a skin tear. He didn't want to be bothered with that stuff, and if you called him, you were going to be sending his patient to the emergency room to get checked out. And I'm sure the emergency room nurses greatly appreciated getting a skin tear at 2 in the morning. And then there was the time that I gave insulin that was Humulin instead of Novolin. They were compatible and equal, but I was a new nurse and it still scared me, and I still reported it as a med error because it was not what the order said. And the doctor made me send that patient to the emergency room. Of course, nothing came of the blood sugars. It was all fine. But in my nursing career, 2 of my med errors, of my very few med errors, were related to insulin. So I'm really neurotic about insulin and blood sugars. It's become part of something that makes me feel nervous. I think it's really important when you're a nurse on the floor to be paying attention to your diabetics, make sure they're getting their snacks. I was probably the the snack dictator. I made sure those patients would get their snacks. I was on people's behinds about snacks, and I carried snacks on my cart. I think most of us nurses in long-term care and skilled nursing carry snacks on our cart. I will say that for the most part, most doctors are pretty understanding, but here's the thing. Doctors go to school to be doctors. They go to school to diagnose, to treat, and to care for their patients. Nurses carry out those orders for the doctors, and they provide assessments. Essentially, nurses are assessing patients, monitoring them, and reporting back to the doctor. And the doctor then makes recommendations based on those assessments, as well as her own. Doctors come in and make rounds in long-term care facilities. They have nurse practitioners that come in and round in facilities. I will tell you that there are nurse practitioners that are just as difficult as doctors, and this is coming from a nurse. I have worked with nurse practitioners who would chew you up and spit you out. And as nurses, we shouldn't be doing that to each other. But I knew nurses that would be afraid of that particular nurse. And it is right that you should have the information that you need when you call a doctor or a nurse practitioner to report a change in condition. You should use an SBAR. You should. Because they're going to ask you questions, and if you're not calling prepared, then they're going to get frustrated with you because they're busy. It's true. They're going to get frustrated with you because they're busy. They have other patients that they're seeing. They have other things that they're doing, and you're not the first call of the night. You're probably the 50th call of the night, and they're tired, and they're not sleeping. That being said, it would still be okay if they didn't yell at you. And I would love it if, I would say I've worked with some really great nurse practitioners who have the patience. They have patience levels that I can't even begin to fathom because I know they're getting called every 5 minutes. And I have worked with some really, really cool nurse practitioners that are the best. You could call them at any time of the day and you would never know they're exhausted, and you would never know what they're dealing with behind the scenes because it's never in their tone of voice. So doctors go to school to be doctors and make those decisions, and so nurses have to report to doctors. That's just the way it is. And it's not helpful if a doctor hangs up the phone on you or yells at you for doing your job. And you don't have to tolerate it either. You don't have to put up with a doctor being rude to you. They are not God. They are doctors. And they are part of your team. They are part of your patient's care team. And it takes the whole team to take care of the patient. Nobody should be treated as less than or irrelevant or unimportant. Every piece of the puzzle that takes care of a patient is important. So I've also worked with some doctors who want to stay on a strict timeline, and they were never yellers, but you could tell when they would get frustrated and it would make your day really hard. I've worked with doctors in hospice generally, and I will tell you that I prefer to talk to doctors that work in hospice. They're busy too. They're doing other things beside hospice, but for the most part, when I collaborate with a doctor in hospice, for the most part, that's not to say I've never been talked to in a way that wasn't appropriate by a doctor. But in hospice generally, the doctors are compassionate and they talk to you with a different level of communication. And I don't know what it's like in hospitals because I've never worked in one, but I feel like you almost forget it's a doctor sometimes unless they have to remind you. You know, you can approach them and not be afraid when you're dealing with a lot of hospice doctors. Now, I've had hospice doctors say things to put me in my place if I overstepped, or if they had an idea that I overstepped. They still reminded me they were the doctor, but not rudely. Now, I have had situations where doctors have said things to me that I found offensive, and maybe when I was younger, I would never address how I felt with what a doctor said to me, but at this age, I will contact the doctor and ask for clarification by the statements that they make. And I'm not rude to doctors. I have massive respect for doctors and what they do and for their education. But there's no need to talk to each other this way. So what I will say is, I've had my experiences with doctors yelling at me before. Maybe sometimes I could have been more prepared when I called a doctor, or I could have had better information when I called a doctor. And sometimes it was not warranted. Sometimes doctors are just angry and tired, and they're just going to take it out on you because you're the person that caught the anger. So tell me about a time that a doctor yelled at you, or a time you had an encounter with a doctor that was less than professional. How did you handle it? Did you talk to the doctor about it? Did you talk to your supervisor about it? Have you ever had to tell your supervisor about a doctor acting in a way that wasn't a professional way to behave? I'd love to hear about it in the comments. And if you like what you see on my channel, then I ask that you like, subscribe, and follow for more. And really, bring me your comments, your suggestions. Let's talk about things. I love learning new things, so I'd love to hear about your experiences. And I thank you for watching, and I hope to see you soon. Bye-bye.